You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture on Air program. Our pleasure, as always, to have in the hot seat in the studio, Heiko. How you going, Heiko?
And I wish it was a hot seat because it's actually quite freezing today.
I know, as we record this program, just about every car you pass on the road's covered in frost. Not mine, though.
No, but that snow in the mountains back there as you come up here at Tonga Road, and then you see that snow in the mountains. It's beautiful.
It is beautiful
scene.
I always like this sort of thing in postcards.
Yeah, it looks like idyllic, doesn't it?
Yeah, the reality is it's freezing cold and you think, no, let's get inside. Anyway, today we're here to talk about acupuncture, for adrenaline fatigue. But before we get there, just remind our listeners, Heiko, we want to come and see you. Where are you?
Yeah, well, I've got my practice in Hastings. That's 206 Charles Street. And my website there is acu123.co.nz.
They often find, Heiko, that people in your industry have more than one modality. Is that the same with you, or are you just a specialist in acupuncture?
No, well, I do. There's other aspects to acupuncture, if you like, and it's acupuncture, and then it's also the Moxibustion.
Yep.
And I have mentioned that before on the show, that the actual word acupuncture in Chinese is two words, jin, ju, and basically one means sticking in needle and the other one means burning of herbs. So the Moxibustion is, in essence, a major component of acupuncture, and in fact. Not so much here, but certainly in China and Japan, you have practices where they only do Moxibustion, because it can get that specialist that you can do that, and as well as within that we have a technique called cupping. Again, we've mentioned that on the show. Got quite famous when one of those American athlete swimmers had his little cupping marks all over his back. It was great publicity for our profession. We have another thing it's called gua sha. It basically means sort of scraping of the skin. You can use like a little porcelain spoon or a little sort of almost like a stainless steel leaf, and you rub and you scrape the skin as if you're almost like sort of trying to bruise it, but it's to get the circulation going. And then, of course, you have Chinese herbs, which, of course, is very separate to acupuncture and requires a different type of training, but it's all based on the same theories and then the same philosophy.
Now, you say that there's not much that acupuncture can't help. Can it help with phobias? I mean, if I had a fear of needles, would you give me the needle to cure my phobia of needles?
Yeah, with Chinese medicine, we say that each major organ, like heart, liver, spleen, and kidneys and so forth, is attributed to a certain emotion, and like the emotion like anger is to do with the liver. But fear tends to be allocated to the kidneys. So we would look at, like, you might have a fear of cockroaches, or you might have a fear of flying, or you might have a fear of having an interview with Ken Morrison, right? So then we would generally that these people would tend to have other kidney type signs, kidney deficient signs, weak signs, and we're going to be talking about the kidneys later, actually, on today's topic, which is actually. As you mentioned, adrenal fatigue. Yeah,
no, the only thing I know about that personally is that people who have that are tired.
That's right, yeah, and that will be the main sort of keynote symptom, and that's where the patient would probably go to the doctor first, and I would probably recommend they do that to have everything else checked and ruled out. And often it's when people have these sort of, they can't find anything that they're wrong with them, they're not sick in any way. They might do some blood tests, and they might try some, iron supplements or some B12 deficient, B12 injections, and then it doesn't necessarily improve that completely, washed out feeling, and then now it's people are maybe thinking it's what we call adrenal fatigue.
So it's as simple as getting a blood test, and that'll tell us whether you've got it or not.
Not necessarily so, yeah. That's adrenal fatigue. The diagnosis can be a bit general and a bit vague, and you might have one physician will say it is adrenal fatigue, and another will say, look, adrenal fatigue doesn't actually exist. It's like it's just sort of a classification of a bunch of symptoms thrown together. Though you can do specific tests. One is for the cortisol levels. That's a hormone that gets released because of stress. There's also to do with thyroid stimulating hormone, but then that doesn't always, people won't always agree, well, that means it's adrenal fatigue. That just might mean that you have problem with cortisol, or you have a problem with this, and so it gets it's sort of not a pure and concrete, system to sort of just call it adrenal fatigue.
Is being tired the only symptom?
No, there are a number of other symptoms, and the tiredness often goes hand in hand with the need for stimulants. So you probably have it, because how many coffees do you have a day?
I've already had 3 since I got here this morning.
But stimulants as well as tea, as well as alcohol. I personally think a lot of these people also have the craving for sweets and sugar to give them a bit of a boost. Mentally, the tiredness it goes with, it's difficult to concentrate, it's difficult to focus, it's difficult. Well, I have this problem, difficult to multitask.
Yes.
And that feeling of like being overwhelmed. It's like they're at work, and then there's 3 phone calls and an email and a boss and a client.
Yeah.
And it's like you just go to pieces. You just can't do it. These are some of the other system, as well as that. When the body gets run down, it starts to get. They say the immune system has a problem, and so then they catch colds easily. They recover slowly from colds. So there's a whole sort of, and you can see there's a whole host of these symptoms that everybody would seem to have.
Yeah, well, you've just described everyone that I know.
Yeah.
So what do you do about that?
Yeah, so
acupuncture comes to the rescue again.
As I was going to say, as you know, that acupuncture does come to the rescue. But what's interesting is, in terms of the adrenals, in an ancient China, let's just say from the 1500s, that's pretty ancient compared to us.
Yeah.
There was a famous, well-known physician, Li Shizhen, and he actually first, anatomically described the adrenals. I mean, I guess through a dissection, and he wrote what they looked like, and surprisingly, the attributes to those organs, the adrenals, very much corresponds to what modern science would say, relates to the adrenals. And he did that like some hundreds of years before modern science had found it.
Amazing.
And of course, he didn't call it the adrenals. I mean, they had the Chinese name for it, and the Chinese name for it is basically Ming Men, which sort of means gate of fire.
Yes.
So if you think about those people that that you've heard got adrenal exhaustion or adrenal fatigue, they're tired and they're washed out and drained, the fire is gone.
Yes, they're burnt out.
They're burnt. That's it. Exactly it. They're burnt out.
So often we talk about treating acupuncture sort of like with like. So if they're burnt out, the fire's gone out, we're going to treat them with fire. So we're going to use Moxibustion.
Jeez, yeah.
God, I'm good, aren't I?
You are. I think you should get yourself a job down at the Wellington College lecturing.
Be, yeah,
I mean, you should.
You'd have to send me more notes, though.
Yeah. So that's a common thing with what I do with adrenal type problem, because the symptoms, they're tired, they're cold, they don't have that get up and go, that fire to do something. And so then, we might use the Moxibustion like on the lower back, sort of near the kidney area to tonify, as well as there's other points like on the legs that we, that maybe for kidney meridian points to tonify and so forth.
I wonder though, one of the signs of adrenal fatigue is an increase in weight.
Yep.
So an increase in weight could be overeating, of course.
Yeah, overeating and under-exercise, which is common, which then probably contributes to the adrenals getting strained, because then your body has to work harder. So
if someone was just simply, say, overweight, would you give them the same treatment for being overweight as you would give them for adrenal fatigue?
Often the treatment might be quite similar, because as a sort of simplified general rule, we sort of say people who are yang deficient, and that comes under with the adrenal deficiency, adrenal fatigue type thing. These people tend to be slow, they tend to be cold, they tend to be tired, they tend to be unmotivated, and then they will put on the weight, and then they will struggle because they've got the more weight. So then that triggers it. Well, I can't go out for a run because I can hardly get up from the chair.
Yeah.
Whereas other people, we say when they're yin deficient or they have fire, they're speedy and nervous and fiery, and they've got too much heat.
Yep.
You know, and they can end up being very, very thin, withered, dried out, if you like, the two extremes.
Yeah. Okay, so we're treating adrenal fatigue, we're treating fire with fire because the fire's going out, we want to reignite the fire. What about the needle, though? Would you give someone the needle for that?
Yeah, you definitely do acupuncture. There's big points on the back that we say they're sort of like the main point for the kidneys. We can even do other points that are a bit higher up that actually are anatomically closer to the adrenals. But also then we say the adrenals has a very strong connection, you know, to the kidneys in terms of Chinese medicine. So we would use acupuncture points on the kidney meridian, which might be on the inside of the leg.
Okay, and is that going to address all the symptoms? So not only just being tired, but the weight gain, that blah, 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 blah. Is it going to take care of all that, just one treatment or many treatments might make?
Yeah, but what you'll find is that the acupuncture points have like specialist properties or specialist qualities. Like one might be good for like, you know, lower back pain on the kidney meridian.
Yep.
One might be better for like tiredness. You know, one might be better for if they're having, you know, difficult to concentrate. So then there's different points that sort of, like I said, they're like railway stations on the same line. They have specialist functions and specialist uses.
Okay, now we've covered moxibustion, we've covered the needle. What about the Chinese herbs?
Yeah, and definitely Chinese herbs is quite important, you know, with the recovery process. What you'll find from the more, want of a better word, the naturopathic or the Western sort of approach to it is like, you know, is giving them the nutrition. You say, well, you need the nutrition, you need the vitamins, you need the supplements. See, whereas Chinese medicine would look at it as, well, the problem is not the nutrition coming in, it's the problem is the ability to process the nutrition, process the things. It's a bit like you've got the old rundown car, there's no point in putting, you know, 97 octane best fuel, whatever, into the car, because you need to actually tune the engine and fix the wiring and the ignition or whatever it is. Yeah. And that's a bit like with Chinese medicine. And we would use more the herbs. We say they have a heating or a warming property. If you think about herbs like cinnamon, think of herbs like dried ginger, all these things, you eat them, you feel a bit warmer. So, you eat too much of it, you'll break out into a sweat.
So is it as simple as cinnamon in your morning coffee?
That probably would help, but there's probably a chai might be a better mix. And actually, if you think about a chai and what's in it, I mean, it's got cardamom in it, and they might have cloves in it. It might have fennel seeds in it, as well as the cinnamon. And all these are sort of warm, spicy, and fiery. And that would probably actually be quite a good sort of tonic or whatever to help for the adrenals.
But not quite as nice as a coffee with some cinnamon sprinkled on top, is it, really? What about extra supplements? You know, like we go to the chemist or go to the health shop and get some vitamin B1 or vitamin D or vitamin E. Is that going to help us?
Look, I mean, the naturopathic approach would say that because, you know, their sort of method is to get that nutrition, everything right, that fixes everything else. But as I mentioned before, we look at it, it's more specialist, it's more refined. You've got to get in there and treat specifically for that yang deficiency. And then we say there are certain herbs, and some of those ones that I've mentioned are common herbs, but, you know, not necessarily that's what I would prescribe. They're sort of the simple ones people could do at home, but Chinese herb medicine would get more complicated. There might be another herb like aconite or something, you know, that might be used for that.
Do you see many people with this, Heiko?
Yeah, it's interesting because I tend to get patients that come in for something else. They might have a stomach ache or suffer from headaches or something, and then they sort of say, well, some people think I might have adrenal fatigue.
Yes.
You know, actually, again, because it's this diagnosis, it's not always 100% confirmed. Or people, I mean, some people will actually say, look, the adrenal fatigue is just a made-up name. It doesn't actually really. Right.
You've been in business for 30 years. Are you seeing more of it? Is it like a 21st century disease or a 20th century disease that we're carrying on into the 21st century?
I can't say that I think that is. I mean, I think my patients, people that I've known, they're probably just as stressed now as what they were 30 years ago. I don't know. In your experience, I mean, people might be working more or have more demands on them.
Yeah.
I don't know if you've read recently. In Korea, it's just changed the law now. So you're not allowed to work 60 hours a week anymore.
Yeah. So 52 is the max.
Yeah, amazing, isn't it?
It is. Thank goodness we live in good old New Zealand.
Yeah.
Anyway, it all makes good sense to me what you've talked about. So we're going to finish the show with another one of your weird songs. It's even got a weird title, this one. But before we talk about the song, just remind our listeners, we want to come and see you and talk to you about acupuncture for adrenal fatigue, or in fact acupuncture for anything else. Where are you?
Yeah, I'm in Hastings in Charles Street. I think best bet is go to my website. It's acu123.co.nz.
Yes.
And I think to finish the show, we've got a song by Talking Heads.
Great group.
And the song is called Psycho Killer. What have you got to tell us about it?
I don't even remember listening to that song. Of course, Talking Heads, they had some other great stuff. But Psycho Killer became, when it was released in 1977, thanks to Wikipedia for this, by the way.
Yeah.
It became instantly associated in popular culture with the contemporaneous Son of Sam serial killers. Remember that?
No, I
Don't you remember them in America? That guy, Son of Sam, went and killed all those women.
No.
So anyway, it's a bit macabre, as is your sense of music. So without further ado, here it is. Look after yourself. We'll talk to the same time, same place next time.
Okay, cheers.